Hi, welcome again to CBT Skills Made Simpler. And today I'm going to talk about what you do in your very first meeting with a CBT patient. So, the most important thing initially is your therapeutic relationship. You want to be, warm. You want to be a caring person. You want to be a helpful person and a hopeful person in the sense that you can do something for them. So you've got to get that tone right from the start. The next thing is to use the CBT style, and that's quite a lot of things, but basic things is just your style of questioning. A couple of things to think about is a Socratic style of questioning, so we're trying to draw things out from the patient and get them to have a slightly different perspective. That is maybe a bit more prominent in the sessions, but also applies in your assessment. You also want to follow the CBT structure, and initially you're asking questions about the main problem. You just literally ask that question, and then we'll try and do a vicious circle, and that'll include details about. We'd ask them about an event recently that caused them to feel anxious or down, and we'll analyse that in detail: the trigger, the thoughts, the feelings, the physiology and the behaviours. But at this level, we also put in processes. So we'd think about and ask about uh, thinking errors and processes like imagery, memory, worry, and so on. That's a little bit tricky to ask about, but we'll go into that in a bit more detail. So what else? So we do that. We then, from understanding a bit about the vicious circle as a maintenance factor, we'll go on to ask about the person's goals in reasonably general terms, and then we'll move on to understand precipitating factors. That's usually understood by asking about the onset of the problem, and that might be a problem. It might be it's happened the whole life, or it might be a recent onset. And predisposing factors. So we're thinking about early experiences. We're thinking about the role of core beliefs and rules for living. So we'll ask about that as well. But there's lots of other things that we ask about, but this is what we're thinking about. And normally, if you've just got an hour, you're building a relationship, you're getting a sense of the vicious circle, a sense of some goals, some risk assessment. But you're starting to think about what is this problem? What is the diagnosis? How do I understand it? You want your questioning style, as well as being Socratic, you want to have a kind of funneling style, so asking a nice open question, such as, I might say, do you avoid things because of your anxiety? The person might say yes, or give an example, and then I might say, could you say a little bit more about that? They might say they avoid all social situations. I might say, could you give me an example of specific social situations you avoid? And then I might ask why specifically they avoid them, because we want that detail. And if that's done in a compassionate and caring way, patients will generally answer those questions and expect to be asked them. And indeed, it helps them to feel understood, that you're asking the right questions and you keep in a nice sort of structure. And you're interrupting the patient politely if they're drifting off a bit. So that's an important skill to learn and to be willing to do. At the end of the session, we want to try and give them something to take away, a bit more understanding, a simple formulation, ask them some feedback on the session, and possibly give them a small homework task, which at that stage might be a little bit of reading, a little bit of thinking about the session to come back with. And I always want to be very confident they will come back the next session. So if I see any hesitation about the session, I will ask them about that. Of course, there's more to it than that, but these are just some basic things that you want to think about in your first session. So I hope that's been helpful. Bye.